Hi, this is Grant LeMahieu. With over 17 years of experience in the financial services sector and employee benefits arena, I've seen quite a bit of the inefficiencies and frustrations that the business world and small businesses and medium-sized in particular have faced when dealing with healthcare. So I've compiled information and showing some of these solutions to how this can be addressed now for the new economy and our more fluid workforce in the U.S. We see from a chart from Ms. Magazine, a recent survey in 2007 from an Ed Howard presentation, that healthcare concerns amongst men and women both rank at the top of most of their household concerns. Another chart from Ed Howard, derived from the Pew Research Center, shows the economy is the most important concern going into 2008 and forward. And again, we always see it's always the economy and jobs. Well, healthcare, amongst its as an important aspect of the education sector and jobs concerns and economy, healthcare is intertwined so much in that if we can reform healthcare in a meaningful manner and reinvent it, it should create a variety of stimulus to the economy. Congressman Shadag and Hoekstra, both in a Wall Street Journal article in 2009, agreed that these are Republicans, that we should cover all Americans. This chart, this table that I actually prepared here on some of the key speaking points of what meaningful reform needs to have within its context, we see each column outlined on a variety of proposals and where each constituency aligns themselves with. What's very interesting is to see that there's some common ground outlined with Republicans and Democrats. It's just a way of how do we get there from here. The National Coalition on Healthcare, the NCHC.org, folks that claim to be a non-partisan entity, have put together some meaningful and very approachable literature on this subject and what some meaningful reforms can be. In my own area of the United States in West Michigan, recent articles and from the paper show some of the limitations that small and mid-sized employers are faced with in the area. Again, small shop owners, they have great people working for them and everything, but their business model just can't allow for expenditures for health insurance at the level of revenue that they generate. Again, service workers service and retail workers in particular are the most underrepresented part of the segment as far as what they're offered as in the forms of healthcare coverage in their place of employment. They love their jobs, they're hardworking, yet there's just no way that they can effectively pay for coverage within the wage levels that they are offered. Some other interesting insights from the Grand Rapids Press at the end of 2009, we see that the finance sector of our economy offers the most probability of having coverage through work. And what's real interesting is my own wife, who's a dental hygienist and has to work 3 different offices to try to get full-time hours, that only 71% of people involved in the healthcare sector actually get healthcare coverage at work. Kind of an ironic stat. Then we also see different associations and retailers within the West Michigan area and what their concerns are in healthcare. Kathleen O'Connor from organization CodeBlueNow.org, they did a study and they balanced it. They commissioned this study. One is respondents from the state of Washington, and then respondents from the state of Iowa. So we're trying to get they were trying to get a little more liberal stance view from Washington, a more conservative perspective, and then they polled registered Republicans, Democrats, and then those that claim to be independent voters. And they all feel a majority across the party lines all feel that there's already enough money in the system to pay for meaningful reform. It's just now how to use it more effectively and efficiently. So from my studies and from legislation that was actually enacted by the Republican Party some years back with the idea of a high deductible catastrophic medical plan coupled with a medical care savings account provided the most logical form of a safety net core care concept, which I entitled it core care because it's basically providing a level of protection for every U.S. citizen. And then those coverages are outlined under existing Internal Revenue Code Publication 502 as far as what would be an eligible expense. Also including routine vision and dental, which a lot of illnesses are detected upon routine vision and oral exams at a dental office. So those are critical to get early detection in a lot of the different things to help control costs in the long run. Recently, Mitch Daniels, Republican governor of Indiana, also had Mercer Group do a study on state employees that elected for a high deductible plan and noticed no meaningful change in morbidity, mortality expense, but the inflationary trend of their health insurance costs stabilized and much lower than the average in the U.S. So again, it shows that the philosophy does work. Again, my idea is taking the high deductible one more step is looking at the 2008 median household income figure. If we look at the current IRS deductibility number of 7.5% of our adjusted gross income, the government then allows us anything over that to deduct. Well, the current Senate bill, their target was 2 to 9% for everybody to have an out-of-pocket so-called premium cost to have some kind of health care coverage. Well, that would peg the median household family to have a deductible every year of $3,900 before they would have 100% coverage after that. Again, it's a partnership with the individual to lead a healthy lifestyle, but then a catastrophic safety net if bills get out of hand. My design, what I did is I used the federal employee health insurance menu and looking at what my federal employees in West Michigan have available, my congressman, for example, Pete Hoekstra, and see what it would cost. And I looked at, there's Aetna and Blue Cross plans that are available, and the Aetna plan right now for a single person is about $300 a month, or $3,200 a year approximately, and for a whole family, the cost is only $7,200 per family, which is a very attractive premium rate for that. Here's the math. What I looked at is currently, every U.S. citizen, we're currently on the hook for approximately $200 a month. Every man, woman, and child is on the hook to support this. The current budgets for Medicare, Medicaid, the Veterans Administration Health Plan, and the TRICARE, which is our Department of Defense active military personnel. And by that $200 a month liability, we're only covering select segments of our population and with very disparate rules and regulations and procedures causing a lot of inefficiency. Using my core care idea, modeled again after the high deductible medical care savings account, we could cover every citizen for only $300 a month instead of $200 a month for some people being covered, so an extra $100 a month everybody being covered to have universal coverage. So therefore, my idea of the core care concept is not just about health reform, but how it integrates into creating jobs, retaining jobs, stimulating the economy so businesses can take the money and the liabilities that they had for retirees, for example, and active employees, and that liability of the unforeseen inflationary trend of their health care expenses, and actually put that money to work in their businesses, the things that they know how to do the best to create growth in our economy. So again, we need to move it from the 1940s model and 50s model of employment-based financing to attract and retain key employees. We need to move how our coverage system goes to an individual basis. because we're moving to more of a trend of project-based employment where we may have a job for a contract to work for a few months at a time, and then these employees will start having periods of transition between our next project to work on. So to have an employer-based healthcare plan is very inefficient in our world today. A variety of things that will not work if we really want systemic overall reform. Systemic means just a whole reinvention of how we look at things. We got to start on a very macro view and innovate. We cannot incrementally reform this. If we want reform to work, we can't pick out little bits and pieces. I get a chuckle out of states that say they want to opt out of any federal legislation. They're going to do it by themselves. They got their own plan. Healthcare is so much bigger than that. People travel all over the United States to get healthcare for their family and to have the choice of healthcare in that. So to have each state create their own separate idea of what reform is again looking at it at a very inefficient basis. The problem is way too big for that. Our friend Leonardo da Vinci had this excellent quote a while back, and it's just like this core care. This core care concept is quite simple. It's just it's a frame of mind. It's a concept. It's a whole way of looking at how we currently address things. But again, it's using private insurers, the public sector, the citizens, our business community to come up and really operate on an efficient partnership on what's best for our society going forward. And Leonardo says, simplicity is the ultimate sophistication. So if we keep it simple, we can make meaningful change. Thank you for your time and consideration. This is Grant LeMahieu. You can reach me at GrantLeMahieu.com. That's GrantLeMahieu.com.